My name is George Ngugi. I come from Nairobi, Kenya. I came to India with a C5 and C6 spinal cord injury, and I came to India on the 21st of August through Medsurge. I was able to be in contact with Dr. Shweta and her team, and we have been through video calls and WhatsApp texts. That conversation was about 3 months before we actually decided to come to India to seek treatment. They were able to connect us to IBS hospital, whereby through them we were able to also be in contact with one of the surgeon, Dr. Diwaka, and we were able to go through some of the questions that we had while we were in Kenya before we actually came for the actual treatment. So the treatment has stop.
So on arriving in India, we were received by the Medsurge team, who first helped us with getting accommodation close to the hospital that had been one of the hospitals that had been selected that could help us with the with our case. So we were able to meet the IBS hospital team after a day or two, where they did tests and scans to be able to prescribe the best treatment possible for the spinal cord injury. And it is at this point they advised that we can get spinal cord trial spinal cord stimulation and regenerative stem cell therapy, coupled with neurorehabilitation with cyberdyne. So all this took about 3 days. But on the 4th day, we were in theater. George, my brother, underwent the procedure. It was successful. After about 4 days, we were discharged from the hospital, and he was able to start his neuro rehab phase of the treatment, which took us another we can say another 1 month. 1 month. So overall, I would say the whole experience was fruitful. We got to interact with other patients. The hospital, the IBS team was very good and forthcoming with information. It was important that we were well informed before making any decisions, including for the surgery and for the neurorehabilitation. The facility itself lived up to its billing in as terms of they had all the equipment that was needed. And yeah, overall, I would say it was a positive experience for both for the patient with my brother, and also for us to be able to see what was available for this kind of injury here in India. Overall, in addition, I would like to thank the Medsurge team for having gotten us accommodation near the hospital. That was key. They offered us a lot of support in trying to integrate with the way of life in India, getting SIM card for your phone and such. It really helped us with our movements, and being so close to the hospital, we were going to and from the hospital was seamless, especially in the initial phases after the patient came from surgery, by having to take a cab and all that was quite taxing for the patient. The fact that we were near was a very big plus for us. Anything else? Overall, I would say. Wait, stop. I would also add and say that India is a wonderful country in terms of, you know, being a foreigner and you're here on medical grounds. Everybody is quite, it's easy to get around, I would say that. And you don't feel like a stranger, so that also helped us during our stay here. And I would say the whole experience was impactful. Seeing the advancements that are here, it offers us, you know, hope for these kind of conditions, and we definitely will take back something positive back home, and hopefully, you know, continue engaging with the hospital as his recovery journey continues. Yes, so stop.
Coming to India was a great decision, and for that we thank the IBS medical team and the Medsurge team for seeing it through. Thank you very much.